We are presenting a simple and easily implemented clinical method to evaluate changes in corneal biomechanical properties by differential tonometry. This study was funded by an NIH SBIR grant. McCafferty has financial interest in Intor Technologies in Radcliffe and Reichert. Other financial interests are as listed. Corneal crosslinking is a common procedure used clinically to stabilize early progressive keratoconus. This study was designed to evaluate corneal stress changes following corneal crosslinking by paired differential tonometry measurements. It is recognized that corneal biomechanical changes occur during corneal crosslinking with corneal flattening and reduction in surface irregularities. These biomechanical changes have been difficult to measure dynamically with Corvus ST and Aura. Since CATS measures IOP minus most of the corneal biomechanical factors, the difference between CATS minus GAT is likely a measurement of corneal stress during applanation. Similar differential tonometry measurements of corneal biomechanics have been demonstrated previously using various tonometers such as DCT and Goldman. However, the lack of bias between CATS and GAT using the same tonometer armature measurement technique is a distinct advantage. This study was designed as a prospective open-label longitudinal reference device comparison. 18 treatment-naive early progressive keratoconic patients were enrolled. Each patient underwent IOP measurement with a standard GAT and CATS prism before corneal crosslinking and at 2 weeks, 2 months, and 6 months post-treatment. Central corneal thickness and corneal hysteresis were concurrently measured. Listed are the standard corneal crosslinking procedure parameters on the left, most notably the epithelium is off. On the right, it's noted the results that paired differential IOP measurements of CATS minus GAT IOP increased from essentially no difference to a significant average sustained plus 1.75 millimeters of mercury greater with the CATS prism following corneal crosslinking. Overall, the average IOP went from 12 millimeters of mercury to 17 millimeters of mercury at 2 weeks and then back down to 12. This is probably the most telling finding in the study, illustrated by this graph. The graph clearly demonstrates the CATS minus GAT sloped differential IOP correlation to the biomechanical parameter of central corneal thickness. The CATS measures a higher IOP in thinner corneas than the GAT and has been demonstrated in numerous prior studies. The blue line shows a negligible difference on average between CATS and GAT IOP, even though the average central corneal thickness is 483 microns. In similar undiseased or normal thin corneas, the CATS IOP has been shown to be 3 to 4 millimeters of mercury higher than the GAT IOP. This lack of IOP difference indicates the keratoconic cornea behaves biomechanically different than a normal thin cornea. Of particular interest, however, following the corneal crosslinking, the CATS minus GAT differential IOP, shown in the red line, returns to an almost normal relationship as what you would see in a normal thin cornea. This would indicate that corneal crosslinking reestablishes a more normal biomechanical behavior of the cornea, which is something we suspected clinically. Our conclusion is CATS minus GAT differential IOP is likely able to measure small sustained changes in corneal stress redistribution following corneal crosslinking. It's also a possible indicator of early keratoconus. It also indicates that corneal crosslinking likely reestablishes a more normal biomechanical behavior, which is what we have suspected clinically. The impact is that this is an easy-to-use, sensitive, and powerful tool to evaluate biomechanical changes due to surgical procedures, pharmacologic agents, and disease processes. Thank you.